Hi, my name is Wayne Hayes, and I'm the president and founder of the PatientTrac Electronic Medical Record System. This is a brief introduction into the PatientTrac system. We're currently looking at the PatientTrac desktop, which, as you can see, has the provider's schedule for the day. So each of these elements, as throughout the PatientTrac system, has complete customization. The provider can determine what type of information they want to see on the schedule, whether it's detailed or just simply the patient's name. Additionally, the software on the scheduling component has the ability to enter telephone messages, intra-office communication. Those messages are directed to that user's desktop, and those messages will stay on that user's desktop until such time those telephone calls are returned or that task has been completed or assigned to another party. Additionally, the software tracks scheduling changes during the day, so if there is a cancellation or a reschedule of an appointment, the provider is alerted immediately so they can manage their task or their day properly. On the scheduling component, the provider has the ability to enter a new patient if they need to. Again, the patient demographic component is very user-friendly. However, it is providing complete information to where the name, the address is properly delineated. The software will require a date of birth. Social Security, as most people know, is no longer used as an identification, so PatientTrac just simply uses a default 99999 number. Additionally, in the patient demographic screen, the software will document in the event that a patient is deceased, especially in a senior citizen facility, and once the patient is selected as deceased and inactive in the PatientTrac system, the software will trigger for the date of death. This is to protect the facility so that there's no inadvertent billing against a patient who's dead, or two, someone doesn't inadvertently try to write a prescription, lab order, or even create an encounter or a visit against that patient. To access the electronic medical record system, the provider simply double-clicks on the schedule. The software then pulls that patient's medical record chart. If there's not a visit for today, the software generates an encounter and takes the provider directly to the progress note. The PatientTrac progress note is completely customizable. The end user has the ability to build as many progress note formats or types as they desire. PatientTrac has the three specific specialties within psychiatry for geriatric patient, as you can see here, a child and adolescence patient, and an adult patient. Each of these patient types, once their age is depicted by the software will then add those specific elements unique to that patient. So, for example, in what we call our psychiatric review systems, if the patient's 17 years or older, the software will pull the adult psychiatric review systems. If the patient is 17 years or younger, then the software will present the child psychiatric review systems, which has such data elements as autism, ADHD, and different type of disorders that are unique to the child patient. This component was actually developed by a group of child psychiatrists working with PatientTrac for over 14 months in developing each of these unique data elements and then selecting the terms and the symptoms that they felt was appropriate for documentation on the ADHD patient or autism or these other components. Additionally, PatientTrac will provide the pediatric growth chart for the adolescent patient. This software includes a number of the psychiatric tests and rating scales for the mini-mental status exam for the geriatric patient. The software will store the clock test or the cognitive test, and you can look at the history of those patients' results over a period of time. I want to thank you for the opportunity to provide you at least an overview of the software. We invite you to look at our website and then certainly contact our office for one of our professionals to be able to provide you an on-site or a web-based demonstration. Thank you very much for your time. Have a great day.